Hello, I am Dr. Farshad Amini Behbani and this is short course of Iranian traditional medicine. In this section we discuss about signs and symptoms of distemperaments. There is an unwritten code in Iranian traditional medicine that says 90% of disease can be treated by correcting lifestyle or managing 6 essentials. From the remaining 10%, 90% are distemperaments and can be treated by knowing the signs and symptoms of distemperament and proper treatment of them. So, by knowing signs and symptoms and treatment of distemperament plus management of 6 essentials that you learned them from previous sections, you can treat 99% of diseases. We begin with warmness or warm distemperament. Most common sign and symptom of warm distemperament is feeling warmness. This feeling can be reported by patient or can be detected by examination by healer or physician. When process is acute, both patient and physician can feel it. When process is chronic, patient usually used to it, and this warmness only is detected by healer or physicians. There are some exceptions that not patient, not physician can detect this warmness, but a relative of patient, those who have long contact with patients, can feel it. Sometimes they report very hotness from the body of the patient, especially after mealing. This could be detected in a special fever that we call is a thirtiness or thin fever. The body of the patient becomes thin and thinner by passing time, and the warmness is hiding in deep layer of the body under superficial layer with normal temperature, and physician or healer only can detect it by long touching of the body of the patient. This warmness could be detected on all of the body or only on an organ, on a skin of an organ. For example, warm distemperament of the spleen, warm distemperament of the liver, warm distemperament of the stomach, that patient or physician feel hotness on the epigasteric area, or warm distemperament of the head. The clue in the examination of disease in warm distemperament is that this warmness is like burning feeling in the palm or fingertip of the healer. When you touch a patient with warm distemperament, when you touch an organ skin with warm distemperament, you feel burning in your palm. But in warm intrinsic temperament, the warmness of the body is pleasant, is not annoying. In the cold distemperament, we have the same rule. The coldness of cold distemperament is freezing coldness. It's an displeasant feeling. Let's back to warm distemperament. Thirtiness is another symptom of warm distemperament because water is a cooling agent and patients with warm distemperament have benefit from cold agent. Cold agent could be cold air, cold water, or cold temperamental foods. On the other hand, warm distemperament evaporates water of the body from the pores, from dilated pores usually, and by sweating, so patient needs more water. And that's the why that the urine of a patient with warm distemperament is colorful, is yellowish red sometimes, especially if the liver and the kidneys have warm distemperament. Bitter mouth is another symptom of warm distemperament because the production of yellow bile not only will increase in the liver but also in all of the body by burning other humors to the yellow bile, and the patient report bitter taste of the mouth. Of course, there are some foods that can produce bitter taste in the morning. If the patient eats some garlic or onion at the night, the next morning he or she will taste the bitter taste. This is not a sign or symptom of warm distemperament. You should ask patient this bitter taste during the day, not only at the morning. And should take a history of dinner and what is eaten in dinner. Usually, the signs and symptoms of warm distemperament getting worse by warm agent. It could be water, air, or warm temperamental food, and getting better by cold agents. That could be cold water, cold air, or cold temperamental food. These patients will be worse in summer as a warm temperamental season. The pulse usually is rapid, weak, and sometimes irregular because usually heart as the origin of pulse is involved with fever or with warm distemperament. There are another signs and symptoms special to involvement of one organ with warm distemperament. What is told is were common signs and symptoms. But for example, in involvement of stomach with warm distemperament, you have a smoky, vapory bloating. Sometimes you have taste of raw fish in the mouth. The digestion of fine foods, those foods that have easy digestion, in the warm distemperament will be damaged. They become decompensated very fast. For example, yolk or meat of birds as fine foods be burned, and this smoky smell will be smelled. Of course, yolk is an exception. If a normal person eat yolk, sometimes bloating smoky will be happen, but especially in meat of the birds like chicken, if a person with warm distemperament of stomach eat chicken, not roasted chicken, for example, because the smell of roasting is like a smell of a smoke. A regular soup of chicken, for example, the bloating will be smoky. The mouth will be dry. In involvement of the liver with warm distemperament, the lips have very red colors. The urine is colorful. Sometimes, because of warm distemperament of the liver, the lungs feel disturbing and coughing will be happen. Sometimes headache is a sign of warm distemperament of the liver, because the warm vapor go through the head. In uterus, palpitation is a sign of warm distemperament, or pain in the liver is one sign of warm distemperament of uterus, because uterus has relationship with the liver and with the brain and with the heart. Palpitation because of warm distemperament of uterus. This palpitation could be treated, and patient could feel better with eating sour taste foods or sour fruits. The menstruation in warm distemperament of uterus is blacky red with bad smelling. The lips are dry, for example. Or in kidney, a warm distemperament could cause too much desire for sex, too much sexual desire. There are another signs and symptoms that belong to involvement of each organs. But the common signs is told